Active heel slides, now we're getting the leg to do a little bit more actively, which is going to further and reinforce the control, a bit of endurance, and some strength in the leg during the earlier phase of the rehab to help prevent disuse atrophy, minimize any stiffness as well, and also help promote circulation and manage any inflammation. So to perform, we're going to be laying down with the legs straight. Now what I'm going to do is drive that heel back towards me, sliding the foot on the surface, make sure it can slide. So doing this in a bed on a wood or towel surface is optimal. And what I'm going to do is each rep, I'm trying to go a little further in the range of motion, really focused on recruiting this hamstring, the back of my leg, to perform this movement. And then nice and slow lower through the full arc of motion, getting my knee fully straight, and then bending a little further each rep. Hold for about a 3 to 5 second pause at the top, and then return to the starting position. And again, with each rep, try to go a little further to restore range of motion, go into tolerance, keep the pain controlled. So once we can perform a quad set through the full range of motion, we could start to introduce a little bit of light resistance to build up the strength, control, and endurance of this quadriceps muscle that tends to be inhibited during the earlier phases of rehab after a surgery or an injury. And a nice way to provide some light resistance is using a towel roll. So what you're going to do is just roll the towel roll up slightly. It doesn't have to be very thick. What you're going to do is put it right underneath your knee and then lay down. So I'm going to focus on that quad set. So engaging this quadriceps muscle, I'm going to try to drive my back of the knee down into the table. I'm going to squeeze, straighten the leg. But now I'm going to encounter some resistance with the towel roll, which is going to help reinforce and re-engage this quadriceps muscle. So with each contraction, hold for about 3 to 5 second holds, and then relax. Trying to squeeze as much as I can, as hard as I comfortably can, to restore that quad function. Now, a glute set in standing is a little bit more of a functional way to engage these glutes versus the glute set in lying down. Again, really important muscle group that we get kicking back on early phases of recovery, which will help promote functional mobility. So to perform this exercise, we're going to be standing, and you can hold on to a table just for a little support, but the emphasis is on that butt squeeze. So we're going to clench the butt cheeks together, squeeze and hold 3 to 5 seconds, contracting as hard as you comfortably can, and then relax. So really focused on these hip muscles right in the butt. Try to relax your back and any other muscle groups surrounding the legs. It should be the hips working here. And we're going to count 3 to 5 second contractions, nice isometric hold, and then relax. Now to further engage these hip abductor muscle groups in the earlier phases of rehab, get these progressively strong, more endurance and control, is a clamshell. Clamshell is a great introductory way to start to load these muscles. So to perform, I'm going to be laying down and the targeted side is on the top. We're going to stack the knees. The knees are slightly bent. And if the knees coming together is too uncomfortable, you can put a little pillow in between for comfort as well as needed. Now a big tip here is to stack the hips too. So knees and hips are stacked, making sure that one hip's on top of the other. I like to put my hand here just to monitor what's going on at my low back and my hips, because a very common compensation is when we lift this leg, everybody wants to roll back, especially if you have some weakness here. So keep these hips stacked and forward, monitor with your hand, and I'm gonna lift this leg, making sure my hips stay stacked and I am not rolling back. This is going to engage the hip abductor muscle groups, your glute medius and minimus. We're going to pause for a count of 3 to 5 seconds, and then nice and slow return back to the starting point. The short arc quad is a good early phase exercise to regain this quadriceps control, which tends to be inhibited after a surgery or an injury. So let's get that muscle kicking back on, build a little early phase control, endurance, and light strengthening. So what we'll do is support the back of the knee, either with a pillow, a volleyball, basketball, anything to help support the knee where it's slightly bent. And what we're going to do is engage this quadriceps with a strong contraction, as strong as we can tolerate. We're gonna kick the leg forward, squeeze that quadriceps here, trying to get that knee as straight as we can. Gonna hold this for 3 to 5 seconds, then a nice slow return back to neutral, a little pause at the bottom, and then repeat. Really going for a nice strong quadriceps contraction. Great way to restore early phase knee extension range of motion and control of that quad, which is really important for normalizing how we move about. Seated marches are a nice way to progress in the earlier phases of rehab, focused on abdominal engagement, core control. And what we're going to be doing is maintaining a neutral spine. So we're not dumping the pelvis backwards or forward, we're finding the middle ground. So whatever we feel like that is that neutral spinal position. And I like to determine that with my hands. So I'll find the bones in the front, bones in the back, and they should be relatively level. And I wanna maintain that. So this whole exercise is driven from the core. So I'm gonna maintain this neutral. So I'm gonna lightly engage my core to start in this neutral position, and I'm gonna lift this leg up and then put it back down. So nice and slow, I'm gonna alternate, but I'm ignoring my legs. I'm focused in monitoring my core and my pelvic positioning, making sure that I can maintain this pelvic position throughout the motion without the pelvis dumping backwards or forwards. The seated heel raise is a good way to help prevent deconditioning during the earlier phases of rehab of these calf muscles back here. So we're introducing a little bit of weight bearing here. Our feet are going to be planted sitting in a chair, nice upright position. You can put your hands on your thighs too for a little bit of an added load to the calf muscles. And what I'm going to be doing is driving through my toes and lifting through my heels, really focused on a nice contraction here in the calves, squeezing as hard as you comfortably can. Pause for 3 to 5 seconds, and then nice and slow down and repeat. So go for a nice strong squeeze in those calf muscles, control the descent, and repeat these motions. Now to progress our weight-bearing tolerance, we're going to take on a semi-tandem stance and focus on our weight shifts. So semi-tandem means that one foot is going to be in front of the other, but slightly off-centered here. So this is full tandem where they're parallel. We're going to go off-center, which is going to replicate a normal gait or walking pattern. So let's set that up. So my right foot's going to be the target leg in front. It's going to be in front of the other one, but slightly off-centered to the right. What I'm going to do is I'm going to go up on my heel. I'm going to shift my weight forward. I'm going to pause for 3 to 5 seconds, putting as much weight as I comfortably can on through the leg, and then back off. Now you can hold on a little bit with your fingertips of a countertop or a table if you need, but eventually focusing on progressing the fading away and performing this exercise completely full weight bearing. Hold for a count of 3 to 5 seconds. Getting your body weight over your leg. And as a good visual cue and way to track progress is getting that scale out, put it underneath the foot in front. And now you can really see how much weight you're putting through that front foot so that you can gauge progress, make modifications as needed based on soreness. And it's a great way just to give yourself a little bit of feedback.